Yes,
Thank you, Dr. Deepamala, Dr. Amit Mittal, Dr. and those who attend the English Hindi session. Good evening.
sir, now you are the host.
Thank you. Thank you. Good evening, good afternoon, and good morning. This is the 2029th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Pratiksha Rajendra Ratadiya. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with anyone who likes homeopathy, because the purpose of this forum is to take homeopathy to every home around the world. And so far, we have uploaded more than 3,500 videos in the YouTube. So those who miss the sessions can search IFPH homeopathy at YouTube. Let me come to today's guest. As you all know, today our guest is Dr. Pratiksha Rajendra Ratadiya. She has completed MD in homeopathy and C.G.O, C.C.H, NTET pass, and she is working as the assistant professor, Department of Homeopathic Repertory and Case Taking, LSFPEF, Lokamanya Homeopathic Medical College, Pune, Maharashtra. And she is the founder of Sanjeevani Homeopathy Clinic, Pune, Maharashtra, and she has presented paper presentation at Homeo World Vision 2025, organized by Indian Institute of Homeopathic Physicians. The topic of the paper for the paper presentation was Brahma Agastya tincture, an alternative for treating primary dysmenorrhea. Some of her article has been published on Homeopathy 360 platform. She has more than 6 years of clinical experience and 2 years of teaching experience. Recently, she has published 2 articles in the following journal, that is Homeopathic Heritage and the International Journal of Homeopathy. That means that she is a hard-working homeopath, and she is willing to share her knowledge to anyone and everywhere. That's why she has presented so many sessions in this forum also. We congratulate Dr. Pranisha Ratedia for the same. And today, Doctor will be talking about clinical cases solved using PHATAK repertory. As we all know that there are different methods of treating patients by using different type of repertory. But there are doctors, certain doctors who are specifically interested in particular methods. So let us see how important the PHATAK repertory in treating homeopathy practice or treating a patient in homeopathy. Welcome, Dr. Pratisha Ratadia. Yes, you can unmute and sorry, I shall make you. Please unmute. I can make you co-host now. Yes, we are co-host now. You can.
Yes, good evening, everyone. Let me just share my screen.
Yes, yes.
Is it visible?
Yes, yes, it's visible. Everything fine.
Yes. So good evening, everyone. Myself, Dr. Pratiksha. Thank you, Dhanesh sir, for giving a nice introduction of myself. I work as an assistant professor in LSFPEF's Lokmanya Homeopathic Medical College, and I am into Department of Homeopathic Repertory and Case Taking. So, first of all, before starting the session, I would like to I'm very grateful to my parents, teachers, and also IFPH for giving me this opportunity as always. Then, now let me begin with my topic. So my today's topic is clinical cases. Those are solved using FATAK's repertory. So Dr. Fatak has compiled a repertory which is known as a concise repertory of homeopathic medicines, and this is the picture. I guess many of the homeopaths must already be using this repertory, but then too, I would like to give a short introduction regarding how was the repertory published. And this is the story behind the repertory. So before discussing the few cases, I would like to tell you or tell all the homeopaths regarding the story behind this repertory. So Dr. S.R. Phatak studied many of the stalwarts and their works, right from Dr. Boni Hussain, Dr. Kent, Dr. Boger, Dr. Clark's dictionary also. So all these stalwarts, Dr. S.R. Phatak had already studied. And he had with him an idea of preparing and arranging one alphabetical repertory, which will be very handy and useful for quick reference. So he had already prepared. So the repertory which we see now, which we know as a concise repertory, is actually personal notes of Dr. Phatak, which were into Marathi language, and he had prepared those notes. And we can say it was a rough diary which was kept with him in his clinic, and he used to discuss those things with his disciples, whoever homeopath used to come and learn from Dr. Phatak. So Dr. S.L. Kapadi was one of the dearest friend of Dr. Phatak, and he had seen this copy. He was a non-homeopath, he was a non-medico person, but when he had seen, he took that copy from Dr. Phatak and he made or arranged it into a proper repertorial format and then showed it again to Dr. Phatak. So Dr. Phatak viewed that, and then he was very, we can say he was very happy with whatever work a non-medico person had done. And then Dr. Miss Homai A. Merchant, she was one of the homeopath who was a disciple or who had come to learn at Dr. Phatak's clinic. So she typed the handwritten copy, and then in this way, Dr. D.S. Phatak, who was a son of Dr. S.R. Phatak, published the first edition of the book. And later B.H.M.S. publishers published it, and the recent edition is the fourth edition which we use. So this was the short story behind the repertory. Then key points about the repertory. So these key points have been taken from the preface of the repertory. So I would like to just explain those points as well. This repertory is intended to serve as a handy and useful reference book. Remedies for a particular rubric are reduced to as minimum as possible by careful selection. So because it is used as a reference book, the remedies are just up to the mark and minimum. No drug is given unless the author, that is Dr. S.R. Phatak, has used in his own practice. So I would like to grab your attention towards this sentence, that only and only those medicines which are used by Dr. Phatak in his own practice and he has got the results, only those medicines have been included. And otherwise, the other criteria is if stalwarts like Dr. Boger, Dr. Kent, Dr. Clark, if they have emphasized or given a proper justification, only then and then those remedies have been included or rubrics have been included. Then a concise repertory cannot. So Dr. Phatak also says in the preface that this is a concise, that is a short version. So this short handy repertory cannot take the place of exhaustive repertories like Dr. Kent's repertory, but it is useful for quick reference purpose. So it is aimed at reducing the burden of the prescriber in every sense of the word. Another few key points are, it is an alphabetical repertory. So everything, that is mental generals, physical generals, modalities, organs, their subparts, all are arranged according to the alphabetical order. Even the physiological, pathological conditions, appetite, aversions, desires, nausea, vomiting, fever, pulse, all these are also arranged in or follow an alphabetical format. Also, cross references have been given in the repertory wherever they are necessary. Then when we come to find the general modalities into the repertory, so we will find if the modality which we are supposed to find or locate in the repertory, if that is a general modality, then if aggravation and amelioration are given in capital letters, so it means that those are general modalities. They belong to the body as a whole. And if for particular modalities, if we are searching, then they are given in small, into the small letters. Then at the end, Dr. Phatak says that repertorization does not mean mechanical repertorization. Totality of symptoms does not mean just the numerical totality, but qualitative totality is important. It means that even if in the case we find just two symptoms which are very peculiar to that case, that too can be considered as totality. What we see nowadays in big seminars, I'm very sorry to say, what we see in big seminars, case presentations are done and 7 to 8, 10, 12 symptoms are taken into the totality. So this is what Dr. Phatak was trying to say, that while repertorization, it is not just a mechanical process of putting the symptoms into the repertory and then arriving at the conclusion. Totality will always mean the quality. What is the importance? What is the, we can say, key point in that case? And only that and that, or those 2 or 3 symptoms, if we taken in a proper format, repertorial totality can be formulated. So that is the concluding remark given in the preface, that one peculiar concomitant or unusual symptom can determine the totality of the case. So if in our given case, and that is what I think is the quality of a good homeopath, to trace that particular symptom. And this is what I think in the previous session, Dr. Amit Mittal sir also was emphasizing on observing the patient and on finding the key detail into the case. So let me begin with my case. Today I'll be sharing 7 of my cases if time permits. Here I'll narrate the whole case, and I would like everyone to just enter into the chat box whatever rubrics or remedies you think. So if this becomes a little bit more interactive, then the session will go nice. So this case, I will call it as old lady and her scratching. So this case was of a 72 years old female patient of mine who came to the clinic, and there was complaint of itching over body, especially over the back, lower limbs and arms. And this itching was aggravated at night time. Severe itching was present with desire to constantly scratch. And itching was there without eruptions. So on examinations, there was no eruptions, skin eruptions. Then family history. On inquiring about the family history, I came to know that there is history of malignancy in her sister. Okay. I would also like to add one point is, here only the key points which I feel important have been taken. I have taken the case into details, but I'm sharing only the points which I feel are important or necessary to be shared, so that our time will be saved for further cases. Now, here are a few mental symptoms which I have seen, and those were, she desires music because while talking to her casually, she told me that she was a music teacher and she had a lot of interest in taking music classes, music lessons, attending the musical programs. Then there was constantly a fear of disease present in her, and also there was fear of death. Now, let me tell you, this fear of death was just relating to the fear of disease itself. The fear of death was not so much marked, but I have considered it. Fear of disease was, she is a 72 years old female, and currently she was not having any as such comorbid conditions present like diabetes, hypertension, or any other disease comorbidities. But then also, because of this problem of itching, she constantly used to think that she might have some disease, and her emphasis was on malignancy, which her sister already had. Then loquacity was one of the symptom which I thought is very marked in her. Then after inquiring about how was her childhood, adulthood, I found there was a history of domination. So she was constantly talking to me, and she was narrating about how her initially her father, then her husband did not, allow her to live life on her own terms. So this was what I felt important, and I took it as ailments from domination. because she is now currently 72 years old. She runs a small shop, and the shop is a few minutes away from my clinic. So this is what all I observed. And then on examination, the weight is 54 kgs, BP is 150 by 90 of Sg. Then prescription. So what prescription I thought is, after forming all, or after taking a whole of the case, I concluded that carcinosin 30 should be given to the patient. I gave her carcinosin 30, 5 doses, and followed with SLBD for 7 days. And after a few days, she came back and she gave the follow-up as itching had reduced by 25 to 30%. Then she added that there was no need to take cetirizine, which she previously used to take. And sorry, I forgot to mention that. And then I thought if the improvement was 20 to 25 to 30%, carcinosin might even improve a bit more. So I continued her on SL. Next time, she came with, again, she said itching is reduced, but now this time there was severe headache from sun. There was acidity, there was vomiting, and one more complaint of insomnia was added. So here, again, this I would like to mention over here, I always give importance to the symptoms or to the things the patient emphasizes. This is what I have learned from my teachers as well, that instead of asking, even Dr. Hahnemann says us the same, that instead of we putting words into the mouth of patient, we should always give emphasis on observation and what the patient is ready to tell. So this is what had come from her as a patient, that there is a domination from husband. There is fear from husband, and at this age of 72 years also. So I took a few more rubrics, that is ailments from suppressed emotions, ailments from abusiveness, ailments from domination of husband. And because she had this complaint of insomnia and sun headache, acidity, vomiting, excuse me. So I gave the medicine of natrum carb 30, 3 doses, and SLBD for 7 days. Now let's see what happened in the next follow-up. So during next follow-up, there was itching present all over the back. And along with it, there was itching which was aggravated at night, and sleep was improved. So here I would also like to add, I had given Kali Phos 6/6 as a biochemic because she had complained of insomnia and overthinking. Now here, the sleep complaint was improved, but again the itching over back was present. This is the intensity which I have marked by giving 2+, which was over back and lower limbs. So the rubric which I had thought of from PHATAK's repertory is skin under, if we go alphabetically, if it would be nice if all of the homeopaths over this platform are having a repertory and you open the PHATAK's repertory, it would be easy for you to understand as well. So skin itching old people in, and there are a lot of remedies, among which meserium was one of the medicine which I thought of prescribing, and I had given meserium 30 BD. Then what happened next? So next, itching was present. Next time when she came for follow-up, itching was present, and it was a lot of itching present, which was specially aggravated during night time. And then now I thought, because the patient had shown so much of patience while taking treatment from me, that although she had every month she used to come and she used to have the same complaint of itching, which was getting reduced, but which was not getting completely cured. So this is what I thought of, that let me again restudy the case, find the key symptoms, and then treat. It might be that something was lacking in my case taking. So itching, which was aggravated at night, this only on this complaint, on emphasizing on this complaint, I thought, let me again go through the case and give some medicine. So I went through the repertory, I found the rubric and gave her this medicine, 5 doses. And after that, let me tell you everyone, she felt completely better and no recurrence of this complaint of itching till date she's having. So this follow-up has been done. I'm so sorry. I have mentioned over here 2026. It should have been 2025. Okay, so 3rd of December 2025 is the date on which I have taken her follow-up and I have given her the medicine. After that, till date, she hasn't returned with this complaint of itching. And yes, I always keep on meeting her, so it doesn't mean that she was not cured of the complaint. So any idea regarding what can be the rubric? I'm so sorry. I just showed everyone. So you can just. Okay. So Dr. Ram sir is saying arsenicum album. Anyone else who would like to add some inputs regarding medicine or regarding what the rubrics can be? Otherwise, I can continue with the case. Okay. So I guess I'll continue. So the rubric which I have taken, if you all are having PHATAK's repertory, I would like to grab everyone's attention towards the rubric. And the rubric which was based on simply the facts present in the case without me overthinking, overanalyzing and interpreting the case of domination of husband, ailments from suppressed emotion, etc. So that rubric is rubric itching, eruption without, aggravated at night. So this is a single remedy rubric which is given into the PHATAK's repertory under itching. So itching, then sub-rubric is eruption without and sub-rubric is night aggravation. And this is what simply the patient was trying to constantly tell me through her expressions and through her case taking whatever I had done. But it was me who couldn't arrive at the conclusion earlier. And the single remedy is thyroidinum. Thyroidinum is the single remedy for this complaint. And I have given this medicine and till date there is no complaint of itching. I have given thyroidinum 205 doses. So now this is the next case of an old lady and cut sound from knees. So this is the words which are used by the patient herself. So now what had happened in this case is a 60 years old female patient who was widow, came to the clinic and she's a known case of hypertension. And she had following chief complaints since 3 to 4 months, that there is cracking sound from her knees, which is 2 plus I have written because that cracking sound is constantly present and is bothering her, which she mentioned with that intensity. Then the next complaint is pain in both knees occasionally, which is ameliorated. Pain in both knees is ameliorated when legs are hanging down. So this is lombat rahane is the word used by patient. It is because I live in Maharashtra and people here use Marathi as their mother tongue. So this is what the word of patient's word. So when the legs are hanging, she feels better. And she feels better by sitting also. Okay. So associated complaints. So very much emphasis by me that whether the patient would like to give or add some more other complaints. She said she has complaint of incontinence of urine sometimes, which is aggravated by coughing. And she has complaint of sleeplessness up to 3 to 3 a.m. she is not able to sleep and she becomes sleepy during morning hours. So this is quite natural, I think, because if the patient is not able to sleep at night, obviously during the day, patients might feel sleepy. Now, here are some of the mentals. So fear that the sound coming from the knees would lead to fracture and eventually lead to immobility in a few days. So this was the fear of the patient which she expressed. Then there was fear of operations. She used to think that that sound which is coming from her knees while walking or doing any movement might lead to some kind of fracture. Such was the sound which the other persons or people were also able to hear. Then the patient is talkative. She says that has visited allopathic doctor and they have said that that sound might be due to old age and some calcium deficiency, for which she has obviously taken calcium supplements as well. Then on examination, the weight of the patient is 66.6 kgs, BP is 144 by 90 mm of Hg. She is a patient of hypertension and her BP is all right, I guess. Then on local examination of the knees, there is crepitus, which is hurt. Then what are the rubrics which you all think might be indicated in the case for finding, or which will help us in finding the remedy? Or even if you can arrive at the remedy, anything will be fine. Anyone can, you can just write in the chat box. Any rubrics, any medicines you think of. Because we are studying PHATAK's repertory. So even from PHATAK repertory, if you say, that's fine. Okay, so moving forward. Knees cracking. So under knees, if we see, there is a sub-rubric given into the PHATAK's repertory, that is cracking. And the second rubric which I had found is hanging legs ameliorate. So ameliorate I have written into capitals because it is a general rubric, general modality, I mean. Okay. And then what is the remedy? So the remedy that came up was conayam. Conayam was the medicine that came up. And conayam is a single remedy for knees cracking. Under knees cracking, conayam is a single remedy given. And after the follow-up, let me tell you, the patient was so much satisfied because the cracking sound have almost more than 60% the sound has reduced. Now the patient herself does not hear the sound, and I guess this is helping her a lot while she does her daily routine, or even if she's on calcium supplements, but that anxiety has reduced, and I guess even it has helped her in her overall well-being. So this is conayam, and these are the rubrics which I have given. So my next case is of a young boy, and who has a problem of constipation. So now let's see what is the case there. So this is a 9-year-old boy who came to the clinic along with his father. He was an old patient of mine and used to visit often for frequent infections of cough and cold. His exams got over and he had gone to his uncle's place during holidays. And after coming back, the child complained of difficulty in passing stools, anorexia, and pain in abdomen. And yeah, this is it. This is what the case had been given. So many times what happens is, during our clinical practice, although we intend to give our whole time and attention to the patient, a lot of times there is limitation either from patient side or our side. Sometimes the whole case is not being narrated or there is nothing much to share. So what our duty as a homeopath is to consider the facts, whatever are present in our case, and to arrive at a medicine given. So any idea with this short information, what medicine or what rubrics can we think of? So the rubric which I have taken in this case is constipation, home away from when. So this was the main complaint of the patient, that he had gone at his uncle's place for his vacations after the exams. And since then, he had difficulty in passing stools. He hadn't passed stools in a proper way at his uncle's place also. So this is the rubric constipation, home away from when. So when the patient is away from his home, he will have this complaint of constipation, which was again confirmed from his father that whether he has this complaint whenever he goes out at someone else's place. And his father had agreed to this symptom. And let me tell you, only a single remedy is given for this particular complaint of constipation away from home when. And that single remedy, any idea? So that single remedy is lycopodium. And to my surprise, lycopodium was the medicine with which I was treating the child for his old complaint of frequent infections of cold and cough as well. Because the weight of this 9-year-old boy was the boy was 9 years old and his weight might be between 25 to 30 kgs. So that is, he was very thin. So there is a rubric for it, and that rubric, I don't know whether we'll be able to find or locate into the PHATAK's repertory, but that rubric is that cough in pinning boys, that is boys who are very thin. And that is also a single rubric medicine, and that comes to lycopodium. And again, from using PHATAK's repertory for some other complaint also, the medicine came as lycopodium. Okay. So now let me move, let us go towards my next case, which is of hair fall in a young girl. So now let's see what were her complaints. A 28 years old female patient came to my clinic all stressed due to her complaint of hair fall. On inquiring how many strands were lost, I got to know that there was hair fall from combing hairs, washing the hairs, and even after touching the hairs. So number of strands, how much hair fall was present. So she said that approximately 100 strands she might be losing, and hair fall which was present in bunches. And when on inquiring about the modalities, so she said hair fall is aggravated especially while washing the hairs. And on taking the whole of case, I got to know that there was some problem in her marriage which led to separation from her husband and leading to complaints of insomnia, weight loss, and anorexia. So these three complaints were also present. But again, as I said a few moments earlier, that the emphasis of the patient was for her complaint of hair fall. So it was my duty to take the whole of her ODP, origin, how the complaints had started, and then arrive at the complaint of hair fall. So any idea about what rubrics or what medicines can be thought of in such case? So moving forward, okay, we have Yes, sir. Yes, Ram sir. Acid phos is the medicine. Well, this shows the experience level of the homeopaths attending my session. So yes, the medicine is acid phos. And what rubric I had taken? Let me show you that. So hair falling, grief from. This is the rubric which I have taken from PHATAK's repertory. And this is again a single remedy rubric. And the medicine is, as sir said, phosphoric acid. So now let's move towards my new case. Next case, that is doctor treat me first. So this case I have labeled as doctor treat me first because these were the expressions of the patient whose case I'll be sharing. So this is a 40 years old female patient who came to the clinic, and patient was supposed to sit in the waiting area as I was already having one patient inside my cabin. But she directly came inside and with very tensed expressions on the face, she said, "Doctor, it's urgent. Look at my complaints first." And because I was already having a patient in clinic in my cabin, so I just requested her to sit outside for a few minutes and attended my previous patient and then took her inside within 5 minutes. So the patient had a complaint of abdominal distension, loose stools 3 to 4 times, and since night previous day night she was having this complaint. And on inquiring modalities, she said she ate stale rice yesterday afternoon and stale food causes her distension always. She said she feels better on empty stomach. Her son, who had come along with her, said she has become very restless and is walking about in her living room, in their living room continuously. So, any idea what rubrics can be thought of? Yes, so Ram sir is answering. Acid was menses during, okay, Nux vomica. So Nux vomica is the medicine sir is thinking of, which would be a good choice, sir. But considering whatever the facts, whatever the case told me was, let me take you to the next slide. So we have two rubrics which I have taken over here. That is abdomen, food stale aggravates. Because she had given this ailments from, clear-cut ailments from that she had eaten stale food, yani ki basi khana khaya tha. Then because her son also said, and the way she entered my clinic, so I thought that I should take this rubric as agony, anguish, cannot rest in any place. And the remedy comes as arsenic album. So let's move towards my next case, which is of a school-going girl and corn on her feet. So this is a case of a 15-year-old female patient who comes along with her mother, and she has complained of corn over her soles of feet, both soles of feet. Initially, it was on the right side. Now it is present on both soles. And the mother says she has tried multiple medicines for her daughter, but nothing gave permanent relief. And girl says whenever she goes out outside barefoot, or even wears her shoes for some sports event for a longer duration, she gets those corns. And those corns are painless, but the skin over the area becomes thick. So this is not the picture taken of the patient, but this is how it resembles. Okay. So any idea what rubrics, what medicines can be thought of? So the rubrics which I have taken is callosities, corns, pressure slide from. And the medicines which we have over here is Antim crude. So Antim crude is the single remedy given for both of these rubrics, especially callosities, corns, pressure slide from. And with a few doses of antimonium crudum medicine, the patient was all right and she didn't complain of any recurrence since then. Now, moving on to my next case, which is of daughter's marriage and weakness. So these cases I have labeled so that there will be some fun part in discussing what cases rubrics are. So this is daughter's marriage and weakness. So this is my last cases. That is a 64-year-old tall and slender looking female patient came to my clinic with complaint of weakness and fatigue. She had her daughter's wedding last week and had almost 35 to 40 guests for the pre-wedding functions at her home, and she says she didn't hire any catering services for the same. Now says she feels dizziness and weakness all the time and started weeping, remembering her daughter. So this patient is also one of the old patients of mine. So we usually discuss, we in the sense she discusses some of the family matters with me. And because we had a good rapport already, she started weeping, remembering her daughter because she had got her married just the last week. So what are the rubrics which can be thought of? Because this is the last case, I would like if every one of you participate and just make it a little bit more interactive. So Ram sir is saying pulsatilla. I would like a little bit more inputs from people who have joined up. I really appreciate that on a Sunday evening, people have joined up for my session. but it would be even more appreciable if people even respond into the chat box. So let's move towards what rubric I have taken. And rubric is weakness, exertion, aggravates. Weakness, exertion, aggravates. And gracile. So let me grab your attention towards the complaint that
Madam, please explain. Grass is.
yes, sir. I'll just a moment, if you would excuse me. So here, because the patient had got married, because a patient had got her daughter married, and there was grief. So let me tell you, a lot of times this grief is acute, and whenever, because the patient had started weeping, we thought of pulsatilla or any other medicines which can be relating to grief. But this grief is not of a long-standing origin. Neither it is to be treated, is what I think from my angle. I thought of taking ailments from other than that. That is, she had 30 to 40, 35 to 40 guests to attend, and there was no catering service. It means that she had done the whole of work along with her family members. So it was a lot of exertion present. Along with it, there was weakness and fatigue. And so I had taken this rubric of weakness, exertion, aggravates. And gracile, this rubric I have taken. This is a single remedy rubric for phosphorus. Phosphorus is the medicine which I have given the patient. And gracile, it means tall, slender looking and beautiful. So into the PHATAK's repertory, under this gracile rubric, we have just one medicine present, and that is phosphorus. So people or females who are very slender looking, tall and beautiful, which are attractive looking, this is the word which is used into the PHATAK's repertory for such delicate and good looking females. And because this was my observation from the appearance of the patient, I had taken into my rubric selection as well. And so the medicine came up as phosphorus. But even if I wouldn't have taken gracile as the rubric, weakness, exertion after is also having just one single remedy, that is phosphorus. This is one of my observations which I had concluded from one of my previous cases where I was just studying the PHATAK's repertory, and I came to the rubric, and then I thought of searching it into the dictionary when I got to know gracile means tall, slender, delicate and attractive. So this is what my 7 cases were. And I would like to give a few more take-home messages also. That is, PHATAK's repertory, it is useful as a very for a quick reference. Then it is best to observe the factual information. So if some homeopath is present and they are into a dilemma, what rubrics to be selected and what medicine to be given, so this is one of the best books where you can just search for the facts which you have observed into your case and you can give. And it is one of the repertories which even the beginners as well as experienced homeopath, anyone can use. We should be proud of this repertory. All Indian homeopaths, I think, should be proud of the work which Dr. PHATAK has given. And yes, thank you everyone for patient listening. And I hope I helped people to study a few rubrics from PHATAK's repertory.
Yes, Dr. PRATIKSHA RAJENDRA, it's really a very good session, but it was going just like 2020 game. And because of that, people may not be able to differentiate each and every case. But it is better to come up with the case in detail, and you can cut short it into 3 to 5 cases and give little more explanation and a little more explanation to each and every rubric you take, because people need to study these things, because even though we homeopathy doctors, most of the doctors follows the Kent repertory, and some people refer from the product repertory, and so when we are introducing a new methodology, it is better to give how to choose this remedy, because even the gracile, that's a simple single word, but it has multiple dimensions. Just like when you talk about phosphorus picture, tall, slender, everything was there in the description of phosphorus. That's the thing. That's how the rubric need to be explained. Otherwise, it's a very good session. And
Yes, sir.
what happened to how much improvement all these patients? How many of them are totally cured, and how much important improvement happened in each and every case after the treatment?
Yes, sir. So I would like to tell over here is that initially when I had done my completed my internship, I always used to feel that a single remedy, it can cure the patient and the patient will never come up with any of the other complaints. But slowly, as and when I started practicing, I came to a conclusion that might be it is the chief complaint which the patient comes up with can be different, and if we take the case into details, and have consideration of mental and physical generals, we can arrive at one of the medicines which people call as constitutional medicine, which like I had of the lycopodium child, that the same medicine came up even after using some different repertory. But as and when the action of the medicine or potency exhausts, we have to repeat the medicine. And all of these patients of mine come and get relief from the symptoms, but obviously they come up next time with some other complaint within 3 or 4 months. This is what I have observed in my practice.
Oh, okay, that's very good. That means you are keeping the records with you. Am I right?
Yes, sir. Yes, sir.
Yes, that's good, because we need to have such evidences to be published each and every time when challenge is there from other part of the world that the homeopathy is not a scientific system. Then we can put forward these things as evidences and show the world that homeopathy is purely the purest science in the world. Let me say.
Yes, sir.
Yes,
Yes, sir. This is what actually I genuinely feel is that we can no homeopath can or shouldn't claim that they have totally 100% cured a patient of some ailments. But because we go in claiming for good results, and then we end up being called as we just give placebos. But this is not what we do actually. I think a lot of great practitioners are present over here who have more experience than mine, and I'm sure they all have achieved a lot of success by treating patients all through their lifetime by not just giving placebo, sir.
Yes, yes, exactly. Those who want to participate in discussion can raise your hand so that we will allow you to unmute yourself and you can speak to Dr. Pratiksha Rajendra. You can ask your question, and you can give the suggestions to this platform also. What are the things to need to be improved from our part also? Now I am inviting Dr. Ambaresh sir, who was regularly giving the medicine for this session, and congratulations, sir, for coming over here and delivering your experiences and sharing knowledge.
Thank you. Thank you, Dr. Dhanesh ji. Everyone, namaskar. Congratulations, Dr. Pratiksha Rajendra. Very nice. Excellent session. And case presentation is very good according to past selection remedy, PHATAK repertory, and PHATAK Bogar and Boeing Hassan repertory is a very good, and Kent repertory is the best selection. Mind symptom or first rubrics mind symptom is the very good. There are two symptom: subjective symptom and objective symptom. Subjective symptom, first grade of symptom. Then objective symptom, your body language, just like selection of phosphorus remedy, peeping tendency,
Yes, sir.
pulsatilla, peeping tendency, pulsatilla, then selection of Gracil, according to Gracil selection, long जो है constitution, तो change the remedy phosphorus is a very good remedy, and very thanks Dr. Pratiksha, again presentation nice and beautiful describe the case. Thank you.
Sir, let me honestly agree that gracile was not the rubric which I was intending to select at my first looking at the case. But after going to the objective symptom of weakness which the patient was having, and weakness which was aggravated by exertion. So when I found phosphorus, then I thought of the other rubric which also can be thought of, because I had used that rubric previously. If I hadn't studied that rubric previously, I couldn't have arrived at gracile as a rubric for explaining to you all.
Okay, that's because continuous reading and using this repertory will make you a better prescriber. That's what you are telling here. You want to explain
Yes,
that
sir.
also. You cannot just simply use one repertory at a time and then you can go for other repertory. It is better to concentrate on particular repertory and then move forward. Then you will get the better result from that repertory. And that's what. Doctor, anyway, we would like to know something about your practice. What kind of practice? Whether you are giving specific important to a particularly some doctors are specialists in infertility, some are specialists in cardiology, and what kind of whether you are treating all kind of. We all know that each and every homeopathy is a multi-specialist because we used to treat all kind of patients, but we have with us some of our lady doctors who are especially specializing in this infertility and PCOD like that, because most number of cases are coming in nowadays for that, and homeopathy has a solution to that also. So,
Yes,
uh,
sir.
uh, uh,
Sir, so
you
actually,
think
I
that
have no such one specific specialization while practicing into my clinic, but because homeopathy is a mouth-to-mouth publicity, I guess. So whichever patients have first initially come to me for some acute complaint of theirs, and they got treated very well, so they thought, I mean, this whole credit goes to homeopathy first. That people usually think that it is a slowpathy, and then they hesitate to come to our clinics. But when they get good results into the acutes, then they build confidence themselves, and then they come and narrate their chronic complaints also, that doctor, you have cured me of the acute, so can you please look at my diabetes or look at the other complaint. So I would like to share one of my recent experiences. So I had one of my patients who had come to me for this same complaint of xerosis, what we call, that is dryness of the skin. And she was like around 53, 54 years old, and she used to come for this complaint, and then by considering the totality and giving her the medicine, so all of her complaint of itching, scratching got reduced. And then she built a little bit of confidence, because initially she required to take antihistaminic drugs, and after taking homeopathic medicines, she was much better. So then she thought of recommending her son to come to treatment for me. And her son had this complaint of snoring at night. And they just came to me, and I took the case. And then after initial few days of taking treatment for this complaint of snoring, then they got a little bit of relief, and then they built this confidence. So then they thought that they hesitated a bit, and then the son came with his wife, that is the daughter-in-law of the female which used to come to me. And then the son and daughter-in-law, both of them came to me individually, and then they told me that, madam, we are having this problem of primary infertility, and it could be better, or it could be nice if you could even treat this, because more than snoring, infertility is the issue which we are having. And then they showed me the reports, that is the sperm analysis of the male. And the sperm analysis report was having a lot of issues because it was having show complaint or showing that motility of the sperms, even the sperms were reduced, and the motility of the sperm count was also reduced, and motility of those sperms was also less. And so the gynecologist had suggested them other sorts of treatment like IUI, IVF, etc. And they were not into, because the gynecologist hadn't guaranteed results to them, so they were hesitating to spend this money also. And plus there was the other thing was they couldn't get the guarantee of results. So then I took the case because the female had no complaint of PCOD or any other complaint. So then only the male was to be treated. And then, so I retook the case. I considered those symptoms also, and I gave the medicine. And to my surprise also, because I am very new into the practice, if you will see, I have just 2 to 3 years of teaching experience and 6 years of clinical experience. So I wasn't expecting such good results into infertility. And the couple, they just conceived and they came with the USG report. So I was very happy and astonished. And even my belief into homeopathy increased, because these cases I had heard from other homeopaths. And
Yes.
getting those results myself, I thought that yes, I am on the right path of studying the homeopathy and homeopathic medicines.
Yes, that's what that's the reason why I asked such a question, because you have the potential to study homeopathy in a better way. You can become one of the best doctor in that profession, that area also. So if you concentrate more on that, if you go through the videos given by IFBH, have you ever gone through the videos from IFBH other than yourself? May not be. So time to find
Yes, sir.
find out the videos and read. At least visit our presentations as far as possible during this infertility session also. You can become
Yes,
a
sir. Yes, sir. I'll
because
surely try. Yes,
I
sir.
wish for a, I shall I would like to add something more on that, because one of our lady doctor who were attending our Malayalam session regularly, and even she used to attend the English session, and she had successfully treated and cured and got results on infertility more than 75 cases in the last 3 to 5 years
Yes,
with
sir.
simply watching these sessions. And
Yes, sir. Yes, sir.
that's why that's how a homeopathic doctor can become a great doctor. So if
Yes,
you
sir.
concentrate in that way, you will be. We have doctors in Kerala who are running to Gulf and other part of the world every week or every month for this, specifically for this purpose only, and they are having wonderful treatment. We have doctors who are having 1,000, 2,000 successful stories with them or cases with them. So please concentrate in that way. So you not only simply concentrate, you just come out and promote. You give advertisement in your clinic that we have treatment for infertility, PCOD like that, because thyroid like that. Simply just give a noting so that more and more people will become know about, because most people are not aware about these things. They believe that homeopathy
Yes,
is
sir.
homeopathy is for cough and cold, homeopathy is for diarrhea.
Yes,
But
yes, sir.
they don't know the effect of homeopathy in all this. So we need to,
Yes, sir.
we as homeopaths has a duty to publish all these things in front of people, so that you can at least make short videos or short presentation of 3 to 5 minutes. Reels
Yes, sir.
also can
Sir,
be.
I'm really
Okay.
grateful to you also, and to IFPH platform also, because this work since so many days you all of you are doing, and without any interruption. If we see every day the messages come, I would really like to appreciate this, that although people are able to attend or not able to attend, but your message arrives every day over the group that these doctors are going to present. And I'm
Yes.
really thankful that at such age also all the homeopaths over this platform are doing a very good and fabulous work. This is the
Okay.
dedication towards homeopathy which we will have to learn, I guess. Thank you,
Okay,
sir.
Okay, thank you, Dr. Pratiksha Rajeendra, Dr. Ramprasad sir, and those who attend the session in this evening. And tomorrow we will have a session from Dr. Navin Dubey. And with that, we come to the end of the day, 2029. Thank you all. Good night.